Hello everyone. So in today's video we'll be talking about fever. So let's get right into it. Of course we'll be talking about etiology and pathogenesis of fever. Also talk about the types of fever, stages of fever, alternations that could be or become as a result of fever, and we'll talk about why fever is actually good sometimes. And then we'll talk about something special, FUO or fever of unknown origin. Next we'll talk about treatments of fever. And then we're going to go into a different topic, hyperthermia, and then we're going to connect it to fever. So let's get started. So to begin, let's look at the etiology and pathogenesis of fever. What that means is how does fever happens. But before we get into this, let's actually know what fever is. So fever is a complicated pathological process characterized by regulated elevation of core body temperature, in which hypothalamic set point is temporarily reset at an elevated temperature in response to a pyric substance. What that means, it's so complicated. To put it in simple words, it means that your body temperature is getting high due to a pyric substance that causes a hypothalamic set point, or the part of the brain, the hypothalamus, to increase, therefore increasing the temperature of the body. Okay, so let's take a look at how it happens. So it goes through multiple steps for fever to occur. The first step should be the pyrogenic activators attaching to host cells. Now, we need to understand what pyrogenic activators are in the first place. So pyrogenic activators are a number of substances that can activate the endogenous pyrogens, generating cells to produce and release endogenous pyrogens. So it activates those host cells, therefore producing the endogenous pyrogens. Now, the pyrogenic cells are also known as the exogenous pyrogens. Now, we'll get into that. We'll get to that in a minute. Now, let's look at some of the examples of pyrogenic activators. So we have two types of them. We have microorganisms and their products, and we of course have non-microorbital pyric substances. So let's look at the microorganisms. We have bacterium, virus, mycoplasma, fungus, parasites. All of those are pyrogenic activators, or things that upon entering the body will attach themselves to the host cells, therefore activating the endogenous pyrogens. Other type of pyrogenic activators should be the non-microbial pyric substances, and here we have all of those are examples of that. Let's just take two. For example, the anti-cancer drugs. Anti-cancer drugs would cause fever, it would cause an increase in the body temperature, and of course antigens. Now, moving on from the outside substances that attach to the body, the pyrogenic activators, let's look at what happens within. Now, said that the pyrogenic activators attach themselves to the host cells, the endogenous pyrogens will get released. Now, endogenous pyrogens are cytokines produced and released by the endogenous pyrogens, EP cells, the host cells, that circulates to the hypothalamus, goes all the way to the hypothalamus and causes an increase in the body temperature. Simple enough. Now, there are different types of it. We have a typical example of endogenous pyrogens include, or types, are the intrauclein, the tumor necrosis factor, the TNF, or the platelet activating factor. Now, the difference between the pyrogenic, the endogenous and the exogenous, again, like I said, exogenous pyrogens are the ones outside, the bacteria, the parasites. Endogenous are the ones inside. So I'm not reading all that, just to explain it in an easier way. Exogenous pyrogens attach to the TLR receptors, signal transduction, the toll-like receptors within the host cells, therefore releasing the endogenous pyrogens, like the IL-6, IL-1, the TNF-A. All of those are the examples mentioned previously. Now that we understand endogenous pyrogens, let's go to the most complicated part of this video, the part that I need you to focus the most. The thermoregulation part. What happens when the endogenous pyrogens actually enter the brain, and how do they actually get there in the first place? So we have the fever mediators, the things that tell the hypothalamus to increase the set point, or basically have the hypothalamus increase the set point, therefore inducing fever. Now we have the positive regulatory mediators, the ones that tell please increase, and those ones we have examples such as PGE2, CRH, CAMP, an increase of Na and Ca2 ratio, and then NO, or nitric oxide. All of those are positive regulatory mediators, and we'll talk about PGE2 in a minute because it's a very important positive regulatory mediator. Now let's look at the negative regulatory mediators. We have AVP, we have MSH, and we have lipocortin, LCE1. Okay, now moving back to PGE2, so let's assume the endogenous pyrogens went to the hypothalamus or to the brain. Now, what within the hypothalamus gets produced in order for the set point to increase PGE2, which is also known as prostaglandin E2, PGE2. It is a metabolic or an arachidonic acid catalyzed by cytogenesis or COX-2. Evidence has shown that fever induced by endogenous pyrogens mentioned previously require the production of PGE2. PGE2 is considered to be the final fever mediator in the hypothalamus. So we have the pyrogenic activators. They attach to the host cells, they produce the endogenous pyrogens. Now, endogenous pyrogens, they go all the way to the hypothalamus and they activate the hypothalamus. How do they activate it? Through PGE2 and COX2. And this causes the hypothalamus to increase the set point of the temperature, which causes fever. I hope that's clear. Now, let's move from this. Let's talk about a different idea. Here we have the febrile ceiling. What this is that the ceiling, the top of temperature, the top most possible temperature a body could go through. So the human body temperature is almost never allowed to raise above 41 to 42 degrees Celsius during fever. So this is a maximum, you can say. Now, there's a very important idea that we need to understand. Now we know that the endogenous pyrogens enter to the hypothalamus. Now, how do they do that when there is BBB? Now, what is BBB? BBB, or blood-brain barrier, is, let's look at it, it's a separation of circulatory blood and the cerebrospinal fluid, CSF, in the central nervous system. What that is basically a bunch of different cells that do not allow anything from the blood to go to the brain. Only some things that are allowed. For example, we have a couple of transporters. We have the efflux transporters, which release things and then get them released back. So say, for example, we have bad molecules that would affect the brain in a bad way. They go through here, they diffuse down their concentration gradient, but then we have the efflux transporters transport them back to the bloodstream. That's how the blood-brain barrier works. Another example is a nutrient transporter, which only allows certain nutrients to actually travel through. Now, there are actually four types of cells that cover the bloodstream within the brain, and they make the blood-brain barrier, which are the endothelial cells, pyrocytes, erythrocytes, and feed and tight junctions between every cell, between every endothelial cell, of course. Now we know the blood-brain barrier exists. How do the endogenous pyrogens, how do they go to the hypothalamus? How do they cross that blood-brain barrier? Now, there are actually three ways that they cross the blood-brain barrier. The first one is through or via the organum vasculosum lamenta terminalis, or OVLT. Next is through the cytoskeleton-specific carriers. Lastly, via the activation of vagal afferent projecting to the hypothalamus. And we'll go through them one by one. So, the first one is the organum vasculum lamentae terminalis. And what that is, OVLT, it's a part of the brain with a weak blood-brain barrier, or no blood-brain barrier at all. So it's located above the supraoptic rhesus, and it's a circumvacular organ possessing atypical blood-brain barrier, different, weird blood-brain barrier. Now, endogenous pyrogens might enter into the brain by passive transport, so they diffuse through the cell walls down their concentration gradient in the OVLT due to easier absorption. Hope that's clear. Another way the endogenous pyrogens get there is through the cytokine specific carriers. So there are actually specific carriers only designed or only made for endogenous pyrogens, and those carriers are called the cytokine specific. Endogenous pyrogen might be active transported across the BBB, blood-brain barrier, by cytokine specific carriers. Now, lastly, we have the via activation of vagal afferent projecting to the hypothalamus. Here are the steps. The endogenous pyrogens activate the complement system, which activates the Kupffer cells. Lastly, peripherally producing the PGA2, which travels through the vagus nerve into the hypothalamus. Of course, the direct act here is OVLT, the passive transport, and of course the cytokine-specific carriers. So, to explain this better, let's look at the blood-brain barrier picture. Now, we have the endogenous pyrogens in the blood. How do they go through when we have efflux transported that would always pass them back? There are three ways. There is a part of the brain that has a weak blood-brain barrier, which is called the OVLT, and it just passively transports through it. Another way is there are actually different carriers like those ones, this one, the green one here, that are only designed or only made for endogenous pyrogens, so this way they're actively transported. The last way is to go through they take all the way around the bloodstream and they go through the nerves instead. And that is the third way the endogenous pyrogens get to the hypothalamus for it to do the mediation, the basically elevation of the body's temperature. Now that we're done with the hardest part of the class, let's try to relax here and finish etiology and pathogenesis of fever and try to look at the different types of fever. So we have 4 different types of fever. We have sustained or continuous fever, and it looks somewhat like this, where fever is high and then it just goes down and that's it. Now, body temperature remains above normal throughout the day and does not fluctuate more than 1 degree in 24 hours. You see, it's not really going up and down more than 1 degree. It's not going crazy like this. And this is called the sustained or continuous fever. And it's actually a sign of what? It's a sign of different diseases that might be within the body. For example, urinary tract infection, or lobar pneumonia, or typhus, or typhoid. Those are all diseases that having sustained or continuous fever could be a symptom for. Okay, now the next type of fever is intermittent fever. This fever goes like this. It's ups and downs and ups and downs and ups and downs. And as you can see, it's increasing more than 1 degree every time it goes up and down. So elevated temperature is present only for several hours of the day and becomes normal for the remaining hours. Now, it's a sign of malaria, black fever, and septicemia. Now, when you have someone who is presented with fever and you realize that his fever is intermittent fever, you might consider him having one of those diseases. Now, closing that, getting that behind, let's look at a different type of fever. We have the remittent fever. Now, it is crazy, ups and downs, all the way from 38 to 40 within hours, ups and downs, ups and down, ups and down. Temperature remains above normal throughout the day and fluctuates more than 1 degree in 24 hours. And it's a sign of those 2 diseases. Lastly, we have recurrent or relapsing fever, and it looks like this. You just have fever for a day and then you don't have fever, and then suddenly you're having fever again. And it's a sign of only 1 disease, the Hodgkin lymphoma. Looks somewhat like this. So in this one, fever is one in which 1 or more episodes of fever occur, each as long as several days, with more days of normal temperature between. So we have a couple of days with high temperature, and then 1 or 2 days with normal temperature, and then again high temperature again. That's how you know you have recurrent or relapsing fever. Now that we understand the types of fever, let's look at stages of fever. We're gonna get through this one so fast. So fever has 4 different stages. We have the prodrome, the chill, the flush, and the defersence. And in here you have the set point being shown here as the dotted line, and in here, as you can see, the set point increases and then decreases again. So now we're through 1 period of fever, and as you can see, those different stages show different types of fever or show different feelings. For example, the prodrome, you have no symptoms, basically, just maybe headache or whatever. Chill, here's where you feel very cold, you're shivering a lot. Flush is where you're feeling the opposite, when you're feeling hot. Lastly, defervescence, this is when you're feeling cold. The temperature is going back to normal and the person is getting treated, basically. So the pathologic behavior that occurred during the development of a fever can be divided into 4 successive stages, the ones we mentioned here. Okay, now let's get that out of the way, and let's look at different alternations that could be caused as a result of fever. So Number one, the alternation on the central nervous system will have, let's look at it, an increase or a decrease in the excitability. So headache, depression, sleepiness, whatever. We're going to have an increase or a decrease in those symptoms. Now, cardiovascular system, we're going to have an increase in heart rate. So normally, a 1 degree Celsius rise in temperature produces a 15 beats per minute increase in heart rate. A heart rate that is lower than that would be anticipated can occur with Legionnaire disease and drug fever. Okay, let's just get that out of the way. Let's look at the respiratory system alternations. Hyperventilation, breathing too much or too hard, could be an alternation of fever. Digestive system, what would happen to a digestive system? Will have inhibition, so abdominal distension, constipation, or not knowing, constipation. I don't know how to explain that in a lighter words. How would you explain constipation? It's when the poop is very hard. It's hard to poop. Lastly, metabolism. This one is a bit more complicated. The basal metabolic rate increases 13%, while 1 degree elevation in the body temperature occurs, and dehydration, so the person will always feel thirsty. Speaking of feeling thirsty, I want to drink water. Okay, so now we need to understand why fever is good. Now, there is a very big misconception that fever itself is a disease. That's wrong. Fever is not a disease. Fever is a symptom to diseases. Now, treating fever is not always required, and we'll talk about that in treatment of fever, but let's just focus here for now. Fever is a valuable index to health status. Fever signals the presence of an infection and may legitimize the need for medical treatment. Fever inhibits the growth and the reapplication of microorganisms, and it kills tumor cells. Fever also enhances the immune system. So those are all why fever is actually good sometimes, why your body is encouraged to go through its fever session. Now, fever of unknown origin, this is one of the coolest names I've heard in medicine since starting studying medicine 2 years ago. FUO. So in FUO, a temperature elevation of 38.3 degrees or higher that is present for 3 weeks or longer. So we have very high temperature for 3 weeks or longer, and we don't know why this person is having this fever. And it could be a sign of the disease is shown in front of you right now. So, for example, it could be a sign of the lymphosis or the metastasis to the liver, in the central nervous system, whatever. Those are all signs of this FUO disease. Now, lastly, treatment for fever, or how to treat a fever if needed. Now, again, mention if the body temperature is not high enough, more than 40, treatment to reduce fever is often not necessary. It's better to let the body go through fever, to have his immune system be better. Now, in case you have to treat fever, maybe you have to increase water intake, drink a lot of water. Maybe you have to eat sufficient amounts of simple carbohydrates, or cooling methods, like, for example, putting a piece of cloth that is submerged in cold water on the person's head. Lastly, to take medications to reduce fever, and those medications work like this. They inhibit the production of PGE2, therefore inhibiting the hypothalamus from increasing the set point of the body's temperature, therefore reducing fever. Now let's go to a completely different idea, hyperthermia. Now what that is, it means abnormally high body temperature, and this may be caused as part of treatment or by infection or by exposure to heat. So let's give you an imaginary scenario. Those people here in this picture here are in the desert, and they've been there for a very long time, subjected to crazy amounts of heat. Their body's temperature is going to rise by itself. So let's look at some of the causes of hyperthermia: heat-related illnesses, adverse reactions to drugs or others. So it could be a part of treatment, infection, others, or exposure to heat. So we have, for example, some of the diseases that are named that are related to hyperthermia is heat stroke, and those are its names in Chinese. We also have heat cramps, and we have heat exhaustion. Now, this video is about fever, so I'm not really going to get into details on what each of those are. But if you have to study it, or if you want to know about it, you can just read what's written here. Okay, so adverse reaction to drugs. Some drugs cause excessive internal heat production, even in normal temperatures. So, MAOs, or inhibitors to to the hyperthermia or to the temperature are taken or are needed at this point. Now others could be, like I've mentioned, damage to the central nervous system or brain hemorrhage, or different kind of infections to the brain or to the body could be causes of hyperthermia. Signs and symptoms of hyperthermia could be hot, dry skin in typical hyperthermia, and other signs and symptoms that vary depending on the cause. So the skin becomes red and hot as blood vessels dilate in an attempt to increase heat dissipation, and an inability to cool the body through precipitation causes the skin to feel dry. Great. Other symptoms could be nausea, vomiting, headache, low blood pressure, confused or hostile, intoxicated, pale or bluish skin, color unconsciousness, coma. Those are all signs of hyperthermia. So lastly, let's talk about treatment of hyperthermia. Treatment of hyperthermia depends on its cause, as the underlying cause must be correct. Fever-reducing drugs such as aspirin have no value in treating hyperthermia. So aspirin wouldn't really treat hyperthermia. You shouldn't take fever-reducing drugs. How do you treat it? Drink water, resting in a cool place, cessation of drugs. So to stop taking the drugs you're taking. Okay, now that we're done with hyperthermia, we're almost done here today. It's a very long video. Let's look at a comparison between hyperthermia and fever. So in hyperthermia, in fever it results from pyrogens. In hyperthermia, arises from changes within the body or changes by the environment. The set points remain unchanged in hyperthermia, while it changes in fever. Body temperature may rise to a very high level, but in fever there is a limit for it, which we mentioned previously. Treatment with water, alcohol bathing, and treatment with antipyretics or drugs that would eliminate the production of PGE2. Alright, that's all I have for you today. We've covered fever, we've covered hyperthermia briefly, and we looked at the comparison. I hope that includes everything, and thank you for sticking around with me. Goodbye.